Hi everybody, this is Lacey Dickerson. I decided to do my project on workplace violence against nurses because I feel it is something that is more prevalent than people think, and I think it has a greater impact on patient care than people realize. What is workplace violence? Workplace violence is any form of physical, emotional, mental, or verbal abuse experienced in the workplace. This isn't just physical acts of violence. This can be mental, emotional, any form of violence experienced in the workplace. This is my PCOT question. My population was nurses. My intervention was to provide safety for nurses so they can provide quality patient care, both mentally and physically. Comparison is comparing the effects and prevalence of violence towards nurses as opposed to any other form of employment or career. The outcome was how does workplace violence affect nurses' mental health and ability to connect and care for their patients after experiencing workplace violence? The type of research and study I would propose is a survey of all nurses in different healthcare departments and specialties with a focus on experience and victimization of workplace violence and how often it occurs and what kind of post-care is provided to the victim. How does workplace violence differ in different places of employment? So as nurses, we're seeing our patients on their worst day. Them and their family members are scared, they're in pain, they don't know what to expect, they're vulnerable. So sometimes that can lead somebody to lash out. In other places of employment, even if a customer does come and attack you, that person can be removed from the premises, the police can be called, you can file charges, that person isn't allowed there anymore, and basically it's dealt with and you don't have to worry about seeing your assaulter hardly at all anymore. In the hospital setting, especially emergency departments where it's illegal to deny patient care, the victim may be forced to face their assaulter again. While they may be able to refuse direct care of that patient, they still have to be in the same facility in the same area as their assaulter, which can bring up more PTSD symptoms or other symptoms of trauma. How often does this occur? So I searched, my parameters were in CINAHL, full text in English peer-reviewed articles under violence against nurses. And these are two interesting points I found. In this research by Alves Lima and Alves de Sousa in 2015, ambulance, emergency, and nursing services are the most at risk to violence among healthcare workers. That's us, guys. A study by Kowalenko et al. In 2013 said that assault against ED nurses alone were 1.8 assaults per nurse per year. That's a lot of assaults, guys. So this really needs further study. Just 43.2% were at the hands of clients or their visitors. That's almost half. How does workplace violence towards nurses affect them and their ability to provide care? A study by the Bureau of Labor Statistics in 2012 listed PTSD, decreased work productivity, physical injury, acute stress, and even death. I know this is an old statistic, but I still found it interesting. 100 healthcare workers were fatally injured between 2003 and 2007. A separate study by Gates, Gillespie, and Suckup in 2011 showed long-term symptoms of anxiety, anger, sadness, irritability, apathy, self-blame, helplessness, disability, chronic pain, and muscle tension. Every single one of these symptoms could easily affect our ability to give good, quality, compassionate patient care. If I were to do a study on the effects of workplace violence and the prevalence, I would want as wide of a range of nurses as possible to do an anonymous survey. I would want nurses from clinical, emergent, hospice, hospital, different departments, different specialities, including home health, any kind of nurse I could get my hands on to do this anonymous survey just to get the wide range of prevalence of violence against nurses. The kind of questions I would ask to these nurses on this anonymous survey would be, what kind of nurse are you? So what facility are you working on? What type of nursing do you do? How long have you been nursing? How long have you been in this specialty? How many incidences of workplace violence have you experienced in the recent history, let's say the last month or year? How many of those incidences did you report? And how do you feel these incidences affected your ability to work, even if it did at all? Have you even noticed it? And what kind of support or healing services were offered to you, and did you take them, and how soon after the incident? One thing I did come across in all of my research was that their data may not be accurate, And one thing they listed was that the lack of reporting was the issue for them not having as accurate of data as they would like. And the reasons why were very interesting. Many nurses feel that workplace violence is part of their job and they just need to suck it up. As nurses, we seem to understand more so what is going on in our patient's mind and why they may act this way. We understand that they're in pain. We can empathize with them. So sometimes we may find it hard to blame the patient when they do act out against us, or even a fellow nurse acting out against us. Some nurses may not feel comfortable admitting that it's affecting their patient care. They may feel like they may get in trouble for admitting that something that happened on their watch is now affecting other patients that had nothing to do with it. That may be that if they even are aware that they're having any changes in their performance, they may not even notice that their compassion is lacking, that they're distancing themselves from their patients. And these nurses that have reported these incidences may feel like nothing may be done anyway. They've reported something in the past and not enough action was taken, so they feel like there's no point anymore. Or it has backfired on them and they have been blamed for this occurrence happening because they didn't de-escalate the situation enough, or they may even have been blamed for escalating the situation. Either way, this lack of reporting means that the facilities, law enforcement, and other legal sources don't have an idea of the prevalence or of the pattern of the issue, so they can't do anything to prevent it. So what is being done to prevent this workplace violence? A lot of education goes around about how to prevent violent situations because, of course, these have happened before and they have been reported, so they do realize there's a problem. It's just that it needs further study. But what they're doing now is classes such as CPI, like Crisis Prevention Institute, which teaches nurses how to identify potentially dangerous situations, how to de-escalate the situation, and avoid violence at any and all costs. Some of this may include just being in a more populated area or just having staff nearby, especially security officers, because they can provide a visual deterrent. Having staff with you or taking somebody into the room with you for somebody that may be potentially dangerous, whether it be a nurse or a client, can also help deter violent behavior. Consistency in policy enforcement, especially when it comes to nurse-on-nurse workplace violence, can show that there is no tolerance for this. This will be reprimanded, this will be dealt with, may be enough of a deterrent to prevent workplace violence. And then again, proper reporting of incidences. And I know none of these are a one-size-fits-all approach. Every situation is different. But these approaches still do greatly reduce incidences, but reporting them is important so that they know what works and what doesn't. So what policies and procedures are already in place to help nurses cope with workplace violence? All of the studies that I looked at showed that a quick and immediate intervention within the first few hours and days after an incident increased productivity, helped with the after effects of workplace violence, and reduced PTSD symptoms. This is mainly because nurses now feel like they're being taken seriously, they're not being blamed, they're in a safe environment, they have a support system. They are able to process the incident, talk to people about it, and this reduces the effects of workplace violence, such as the PTSD, apathy, and distancing. Why do we need further study? Because if we are experiencing workplace violence, that not only poses a risk to the nurse, but also to the clients that we're providing care to. If we're physically injured and our arm is in a sling or our foot is in a cast, we can't help ambulate patients. We can't walk around to the different patient rooms to provide care. If our hand is broken, we can't draw up meds. If we're emotionally and mentally injured, we cannot focus and give our patients that 100% attention that they need to feel like they are being properly cared for and to trust us. Nurses experience higher and faster rates of burnout after experiencing workplace violence. Just think about it. If you were assaulted at work, you wouldn't want to be there anymore. You wouldn't feel safe there. You would want to be looking elsewhere, and you just would not care as much about what you're doing in that facility. A high prevalence of violence leads to a decline in nurses' mental health, which is then transferred to the patients. To provide educations to nurses and their employers on the effects of workplace violence. So if we don't do further studying on workplace violence, Some nurses may not even know what workplace violence really truly is. They may not know that this is not okay, and their employers may not know how this is happening because the nurses don't recognize it and report it. So this will also affect patient care, because if we're scared, constantly looking over our shoulders, again, we're not paying close enough attention to our client. This culture of it's just a part of the job and toughing it out is extremely detrimental, again, because of that under-reporting. If we don't report it, nothing can be done. If it's not on paper, it didn't happen. And how do we recognize workplace violence and the effects on healthcare professionals if we don't study it and realize what these incidences are and the effects it has on us? And again, it trickles down and affects our patients. So once these more accurate results and data from these studies on workplace violence are obtained, better, more effective understanding, avoidance, reactions, policies, laws, and educational programs can be put in place. And this will help us provide better safety and health for not only our clients, but also for these nurses experiencing this workplace violence. Thank you, everybody.